So as we are continuing with our series of dose calculation, so today we shall talk about units as a measure of dose, or units in international units in the measure of dose, or in the calculation of doses. This is a unique area because when we were introducing, if you remember the video that we did on expression of strength of pharmaceutical product, I also talked about international units as a measure of strength of pharmaceutical products. So certain drugs have their doses measured or expressed in international units, and these units just used to determine the activity of pharmaceutical product derived from biological and other sources. So just as a measure of strength, so some drug strength can also be measured as international units. Just measure the activity, the biological activity. So some of these examples of these drugs include, we have nystatin, insulin, penicillin G, heparin, some vitamins, vaccines. As we are going to see, there are very many of them. There are very many of them. Because in my next slide, I've given us a simple example about this drug. You have here insulin. You know the strength is here. This is benzene. The strength is here. 24 2.4 million or 2.4 million mega units or units. We have nystatin suspension, 1000 international units per mil. This is procaine penicillin, as you can see here, the units. So today's session is just involving calculation of these drugs which have this as a measure of strength. And we shall only study insulin, which would be replicated in all other drugs. What is insulin? This one, you study this one in details when you reach drugs which are used to manage diabetes. So insulin is one of them. Now, insulin is a chain of amino acids. By being amino acid means that it cannot be administered by oral route, because to be destroyed in the stomach, it is a protein, it can only be metabolized, which means that it is given by subcutaneous route. And because we know the international units in a meal, we can easily calculate the milliliters which can be administered to the patient, and we can also extrapolate and determine how long will one vial of the drug last the patient. Now, about insulin, it is always important you educate the patient about the proper administration and storage of insulin. Now, most of these ones you study them when you reach the drugs. Though today for me, I'm basically in calculations, but I just want to give us this simple history about these drugs. Now, insulin is unique because it is given using insulin syringes, which are usually 1 ml, or they can be calibrated with units. Like here I have 1000 units, which is quite 1 ml, or 50 units, even others are 30 units. So these are some of the insulin syringes. Others are units, others could be in mils. So we are going to see how we can interconvert between the units and mils, because on the strength of the drug we have the conversion 1000 international units in 1 mil, so you can easily interconvert. I want us to think further that you can easily interconvert these ones. So I have this drug here. This is biphasic isophene insulin injection, India Pharmacopoeia IP. This 10 mil, the strength is this, which means that the volume of the vial is 10 mils. The concentration or the strength is 100 international units per mil, which means that you can easily determine the quantity of units in the vial. You can use first principles. If I try to explain it here, first principles could be that 1 mil contains how many units? 100 units. What about 10 mils, which is the volume of the vial? 10 mils, which is the volume of the vial, will contain 10 times 100, giving me 1000 units, which is my answer here. So those simple errors I make in my pronunciation, always forgive me about them, but I just want my work to be as original as possible. So this is how you can easily determine the total units in the vial. It means that if you are given a dose of insulin, you can easily calculate. I have these doses here. How do you convert between to mils? Because if the dose is 30 units, 1 out of this times 30 giving me 0.3 which can be administered 20. This is an easier calculation which you can easily calculate, because we have that interconversion on the strength. Always follow that. For 5 units, it is just 5 out of 100 times 5, giving 0.5. You can easily use first principles instead of using this one. But to avoid that, these insulin syringes have been calibrated in terms of units, as we saw here. They have been used in terms of units to avoid that conversion. But mathematically, a lot of questions can be asked on So as already, this has been a short presentation. We have very many quizzes in our classroom, in our Google Classroom app. So always follow the questions and try to attempt them. They'll try to expound our mind and understanding of these calculations. And we have used insulin to calculate these ones, but all others, the heparin, the insulin, penicillin, they will follow the same units. And also, we can relate this international unit to kilogram body weight, as you see some of the questions in the Google Classroom. I thank you for listening to me.